Everyone, bonjour à toutes et à tous. Thank you for joining us. Merci d'être parmi nous aujourd'hui. We are here today to provide an update on the City of Ottawa's response to the COVID-19 pandemic. Nous sommes ici aujourd'hui pour vous fournir une mise à jour sur les mesures prises par la Ville d'Ottawa pour faire face à la pandémie COVID-19. My name is Kina Leclerc. I will be your moderator. Je m'appelle Kina Leclerc. Je serai l'animatrice de cette séance. Before we begin, a reminder to please place your microphone on mute until I invite you to ask your questions. Avant de commencer, j'aimerais vous rappeler de désactiver votre microphone jusqu'à ce que vous êtes invité à poser une question. Today we will be hearing remarks from le maire Jim Watson, followed by Councillor Keith Egli, Chair, Ottawa Board of Health, le conseiller Keith Egli, président du Conseil de santé d'Ottawa, then followed by Dr. Etches, Chief Medical Officer of Health, médecin-chef en santé publique, and Anthony DiMonte, General Manager of Emergency and Protective Services, Directeur Général des Services de Protection d'Urgence. Available for questions from the media following the statements, we also have, disponible pour répondre aux questions des médias, nous accueillons aussi Dr. Brent Malachny, Associate Medical Officer of Health, médecin adjoint en santé publique, Stephen Willis, General Manager, Planning, Infrastructure and Economic Development, Directeur général de la planification de l'infrastructure et du développement économique, and Dan Chenier, General Manager, Recreation, Cultural and Facility Services, Directeur général des loisirs, de la culture et des installations. After we hear from the panelists, we will take questions from the media. We will now begin with remarks by Mayor Jim Watson.
Thank you very much. Merci beaucoup et bon après-midi tout le monde. Thank you for joining us for today's media availability. Sadly, we learned today of the passing of a staff member from the Peter D. Clark long-term care home. This individual had previously tested positive for COVID-19. I'd like to offer my sincere condolences to the family, friends, and colleagues of the worker who passed away. To honor the individual's memory, I've asked that the flags be flown at half-mast at the Peter D. Clark long-term care home from today until sunset of the funeral services. Again, j'offre mes plus sincères sympathies à la famille, aux amis et aux collègues de ce membre du personnel qui nous a malheureusement quittés la nuit dernière. We know our long-term care staff are doing a very difficult job on the front lines. And I want to thank all of our frontline staff for their continued efforts to keep some of our most vulnerable residents safe and healthy during these challenging times. So again, my sincere condolences. Further information on the individual and so on will be left up to the family if they wish to discuss or bring forward a name. But to the family and to obviously the colleagues, our deepest sympathy. On a more positive note, Ottawa was fortunate to have some beautiful weather this weekend, and it was nice to see people getting outside for fresh air and taking advantage of green space in our city parks and pathways. I do want to remind everyone that although we have had some nice weather, and it looks like there will be more of it this week, getting close to 30 degrees, we can't let our guard down. En dépit de la belle température, nous devons rester vigilants. COVID-19, of course, is still in our community. We must continue to remember to practice physical distancing and adhere to the provincial orders that are still in place. Last week, the province announced that certain businesses, such as golf courses and retail services with separate street front entrances and animal services, are allowed to reopen. This is good news for our local economy and an important step in starting to get our communities up and running again. But it can also come with many questions for business owners as to what safety measures they need to take in order to keep everyone healthy. And that's why I'm pleased to announce today that the City of Ottawa, in consultation with Ottawa Public Health, is releasing a toolkit to help businesses reopen safely. This is, I'll just show you, basically it's a very small document in both languages, en français ou en anglais, and it's been vetted by both our economic development folks as well as Ottawa Public Health. And the toolkit is a comprehensive roadmap that will help small businesses plan their safe reopening by having the right measures in place to ensure the safety of employees, clients, and customers. It also helps to answer questions like how to create a physical distancing plan or what steps you need to take to ensure clear communications with your employees, your clients, and your customers. The toolkit excuse me, also provides links to other helpful resources like public health signage, government financial assistance programs, and sector-specific guidelines. Cette trousse aidera les propriétaires d'entreprises à répondre leurs activités tout en protégeant leurs employés et leurs clients. Businesses are the backbone of any community, and we need to provide them with the guidance and support to succeed during these difficult times. The toolkit can be accessed as of now on ottawa.ca/business toolkit. That's ottawa.ca/business toolkit. Information and resources in the toolkit will be updated on a regular basis as guidance from the province and public health continues to evolve. This is only the first of many measures we will be announcing in the coming weeks to help small business in the recovery phase. Next Friday, May 29th at 1 p.m., the city will host a town hall where we will present an outline of our recovery plan in order to seek input from small businesses before bringing it to council for approval. I hope the business community will be able to join us in good numbers, and I look forward to receiving their feedback. J'espère que les propriétaires d'entreprises pourront se joindre à nous en bon nombre pour nous partager leurs idées et leurs commentaires. I want to also thank Councillor Laura Dudas and Councillor Eli El-Shantiri, who have worked tirelessly to help our small businesses these last few weeks, as well as members of the Economic Partners Task Force for their input and assistance, and Dr. Etches and Keith Eglai for Ottawa Public Health's very important input into the toolkit. But I'd like to thank our local business community. We know this has been a very difficult time for our business owners. Je veux aussi remercier tous nos petites entreprises qui ont choisi d'innover au cours des dernières semaines pour bien servir leurs clients. So many of you have forged ahead and come up with new and alternative ways to operate your businesses and to provide your services. You've also done a wonderful job of coming up with, and many of you have come together to support our frontline workers during this pandemic. You're making a true difference in our community, and I want us to say thank you very much. I also want to remind everyone that our #BuyLocal campaign continues. This campaign encourages residents to support small businesses by ordering products and gifts certificates online or ordering takeout or delivery from local restaurants. J'encourage nos résidents à continuer à appuyer nos entreprises locales. You can also support local farmers markets with the new click and collect options, or shop in person at street front retailers offering shopping experiences that respect physical distancing best practices. I also want to announce today that based on Ottawa Public Health's recommendation, the City of Ottawa is extending the suspension of city permitted special events, festivals, and other cultural programs until August 31st of this year. La Ville ne pourra simplement pas permettre les tenues d'événements majeurs au moins jusqu'à la fin du mois d'août. We know this is going to be very disappointing for many residents who like to enjoy our great summer festivals, but as I mentioned before, we need to remain vigilant and keep everyone's health and safety as our top priority. La sécurité de nos résidents et de notre communauté doit demeurer notre priorité numéro un. Mr. Damati will provide more details on this in just a few minutes. And in closing, I just wanted to add that the city's Human Needs Task Force is seeking donations of non-medical masks for vulnerable residents. The city is seeking masks made of at least 2 layers of tightly woven fabric that is breathable, contains cotton sheets, quilter's cotton, and flannel. Masks with pockets or slots for replaceable filters, and masks used to cover other masks or respirators to prolong their use. Residents who would like to make a donation can email donations@ottawa.ca to set up an appointment for drop-off. That's donations@ottawa.ca. Thank you very much. Merci beaucoup.
Thank you, Mr. Mayor. We will now hear from Chair Eglai.
Thank you very much. Good afternoon. Bonjour, Quay. I want to start off my remarks by echoing the Mayor's comments with regard to the worker from the long-term care home and express my condolences as well. These people put forward so much of their time, their effort, to help protect some of our most vulnerable. So it's important that we remember the good work that they do every single day. We had a great long weekend, much better than we thought we were going to have weather-wise. And it was nice to see so many in our community that were enjoying the weather, all the while practicing appropriate physical distancing and wearing their non-medicinal masks. However, please remember to dispose of these in an appropriate manner. I mention this because there's been an increase in discarded gloves, masks, and wipes on public roadways and in green space. Not only is this inconsiderate, but it poses a significant healthcare risk. I urge everyone to dispose of their litter, gloves, and masks where it is appropriate to do so. I, like everybody else, is quite pleased that we're finally experiencing some more summer-like sunshine and heat. I think the mayor said we might get up to 30 degrees later this week. And although the warm weather is welcomed by many, it can provide challenges to some of our most vulnerable citizens. Ottawa Public Health staff have consulted with Health Canada on the best practices to prevent health or heat-related illnesses during the COVID-19 restrictions, and will be updating their Beat the Heat information on ottawapublichealth.ca. Ottawa Public Health will be sharing these best practices with service providers of groups at risk of heat-related illnesses directly, as well as through social media. So I would encourage you to visit OPH's Twitter and Facebook pages. Further, Ottawa Public Health is working to develop resources and a plan to assist residents should a heat wave impact Ottawa this summer. Access to city and community resources such as libraries, pools, movie theaters, etc., are likely to change over the next few months, and our plan will be responsive to a changing situation. Yesterday, many of our local businesses began to open operations. I, for one, celebrate the fact that many incredible local establishments will be able to provide their services once again. In light of the reopening of the many businesses, I'd like to remind everyone that it is incredibly important that businesses and patrons follow the provincial guidelines with respect to reopening and recognize that physical distancing and other prevention strategies are still important. Remember to maintain a physical distancing of 2 meters and wear a non-medical mask when you can't maintain that 2-meter physical distance. Wash your hands frequently. Use cough etiquette. Stay home if you aren't well and avoid touching high-touch surfaces. I encourage local businesses to visit Ottawa Public Health's website for more information on how to operate in a safe manner and to also access the toolkit that the mayor earlier referenced. I see the easing of restrictions as a confirmation that our strategies are working, but it's important to note that we can't take our foot off the gas. It's important that we continue to practice good social distancing options. We use a mask when we cannot do that. So please, let's stay together. We can beat this together, but we have to continue to do what we have been doing. The restrictions are being lifted, and that's important and that's welcome, but we can't lose sight of the goal. And the goal is to maintain the physical distancing and to maintain the wearing of masks when that's not possible, so that we can protect the vast majority of us from this virus entering our lives. So again, be happy the businesses are open, be happy the sun is shining, but please follow the rules and suggestions made by Ottawa Public Health. Thank you.
Thank you very much, Chair Eguy. We will now hear from Dr. Etches.
Thank you. The news of the passing of another personal support worker is very troubling. It's what we're all working hard to prevent, and I do feel for her his coworkers and the family. So I want to talk a little bit more about what we're up to at this phase in the response, and I want to urge people, as others have, to continue doing your part, that everyone's actions are what will make this a manageable situation into the future. So during the next few months, public health's role will be to continue to engage with residents, to do the communication required to help people have the information they need, know what the situation is, to also engage with businesses to make sure that they're opening and reopening safely. We're monitoring the number of confirmed cases, and we're connecting with those cases to identify their contacts and follow up and control also outbreaks in the community. So, au cours des prochains mois, le rôle de la santé publique sera de continuer à communiquer avec les résidents et les intervenants afin de les informer des prochaines étapes, de communiquer avec les entreprises et les organisations pour une réouverture sécuritaire, de surveiller le nombre de cas confirmés et communiquer avec des personnes ayant reçu un diagnostic positif à la COVID-19 et avec les personnes avec qui elles ont été en contact et contrôler les éclosions dans la communauté. We have been engaging with the community, and there's one last day to share your thoughts at engage.ottawa.ca /COVID-19. C'est aujourd'hui le dernier jour pour les résidents de fournissant des commentaires pendant cette première phase de la plateforme d'engagement appelée COVID-19. Partagez vos pensées. C'est participants.ottawa.ca /COVID-19. Since launching on May 1st, we've heard from more than 1,500 residents, and more than 9,000 residents have visited information on the pages to become more informed. And more than 90% of respondents have shared that they understand why we must continue practicing physical distancing, and that they are planning to continue to do this as we ease restrictions. Many respondents are open to mitigation measures like wearing non-medical cloth masks, 89%, and scheduling outings to reduce and limit crowding. So 70% said they're open to scheduling changes of their activities. So this is good news. We will continue to use this platform for more engagement into the future, so I'll announce that in the future. And I do want to recognize that one of the top requests was more access to outdoor space. And yesterday, the reopening of outdoor recreational amenities came into effect, just not play structures yet. So one of the most common concerns we've heard makes this welcome news. I want to also note that Ottawa Public Health was very pleased to have supported the development of the city's business reopening toolkit. SPO est heureuse d'avoir soutenu le développement de la trousse de réouverture des entreprises de la ville. Il est prioritaire que les gens retournent au travail en toute sécurité. Nous sommes ici pour aider les entreprises à le faire pendant cette prochaine phase. So examples of resources in the toolkit include how to set up your space to allow for physical distancing, cleaning and disinfecting, screening tools for employees, and signage for the general public using the business space. And if businesses are not already or ready to open, they don't need to. If people are successfully offering online deliveries, curbside pickup, or individual appointments, we do encourage businesses to continue these strategies because they allow businesses and customers to maintain physical distancing, which has been key in keeping the infections down in our community so far. I do want to reiterate what Chair Eglai said a few moments ago. As we increase our interactions, the work of keeping the number of infections low is to maintain physical distancing and to stay, that means 2 meters away from people who don't live in your household. And if you can't do that, to wear a mask. We're tracking some of the Apple mobility data that shows people dropped their use of their vehicles, of public transit drastically in the earlier days of this pandemic. Transit use continues to be, according to this data source, 70, 80% down. The driving, the walking, again, in the range of down 70%, 60, 70%. The modeling tells us that if we go too quickly in relaxing our interactions with others. Even if our physical distancing drops, by about 20%, we do risk a resurgence in infections. And so, the Apple mobility data is showing us that's creeping back up. We're starting to go back towards our baseline levels of activity. And we do need people to keep in mind, as you're getting out there and you're being more active, that physical distance is what is protecting us from really that upsurge or a second wave, as people have been talking about. So today, we're going to put up a new way of looking at the data. This is maps that reflect the state of COVID-19 confirmed infections in residents by ward. These maps will be updated every 2 weeks, starting next week, and they'll be found on our epidemiology page of the section of an epidemiology on our COVID webpage. While it's clear that COVID-19 is present in every single community, every ward across Ottawa, this does give us a snapshot as people have been asking for this information. Nous allons aujourd'hui lancer une nouvelle carte qui fait état du taux d'infection de COVID-19 chez les résidents par quartier. Bien qu'il soit évident que la COVID-19 est présente dans toutes les communautés d'Ottawa, cette carte donne un aperçu de la COVID-19 à l'échelle d'Ottawa en fonction de la géographie des quartiers. So I want to stress that these maps cannot be used to identify COVID-19 hotspots in Ottawa. That is a different approach, and these maps are really just information that we have that we're sharing in the interest of transparency. Areas with lower rates or higher rates are not more or less safe from COVID-19 transmission, which can occur anywhere in the city. The maps are based on where residents with confirmed COVID-19 live. It does not reflect where the disease was contracted or where exposures might have occurred. These maps are not intended to assist with service delivery planning or recovery efforts or requests for additional services at a neighborhood level. So lastly, touch on our capacity to follow up with cases and contacts. When Ottawa Public Health is notified of a confirmed case of COVID-19, we connect with that individual within 24 hours and we begin the process of contact tracing. In late April, Ottawa Public Health increased the number of staff conducting this case and contact management, and that has allowed us to achieve the 90% target of reaching out to contacts within 24 hours from when they're identified. And we've been following up with between 94 to 98% of cases within the 24 hours. SPO a augmenté le nombre d'employés chargés de la gestion des cas et des contacts, ce qui a permis à SPO d'atteindre l'objectif de communiquer avec 90% des contacts dans les 24 heures suivant leur identification et d'assurer un suivi avec 94 à 98 cas, des cas dans les 24 heures qui ont suivi. So, through this case and contact management work, Ottawa Public Health is seeing that the number of close contacts is now often less than 5, whereas previously it was between 15 to 20 contacts per case on average. And now usually the contacts are household members. Ottawa Public Health will continue to work 7 days a week to contact trace all infections that are confirmed and to prevent further outbreaks in the community. This role is especially important as we reopen, and additional opportunities are rising for us to be in contact with individuals outside of our household. We've made great progress in flattening the curve thanks to everyone's efforts. However, we still have community spread in Ottawa. 17% of cases have no known exposure. And so as restrictions ease, our goal is to reduce the spread of COVID-19, to keep case levels manageable for our healthcare system, and to be able to care for everybody that needs the help. Merci beaucoup.
Thank you, Dr. Etches. We will now be hearing from Mr. DiMonte.
Good afternoon. Bon après-midi tout le monde. I would also like to offer my heartfelt condolences to the family, friends, and colleagues on the loss of one of our personal support workers in a city long-term care facility. The City of Ottawa and the Province of Ontario remain in a state of emergency due to COVID-19 pandemic. I'm pleased to announce, however, that the city has ended its spring freshet flood watch for 2020. Sandbags are being removed from drop-off locations and river levels have now returned to normal. Je suis heureux d'annoncer que la ville a mis fin à sa surveillance des crues printanières pour cette année. Le sable et les sacs ont été retirés des lieux. Protecting the health and safety of Ottawa residents is our top priority, and the city is currently focused on delivering essential services during this pandemic. Based on public health's recommendation, the city is extending the suspension of city-permitted special events, festivals, and other cultural programs until the end of August. These permits are required for events of more than 500 people. So what this means is that major events won't be permitted in Ottawa before the end of August. For events under 500 people, they don't necessarily require a permit, but organizers must still adhere to the provincial regulations. And under the current provincial order, limits of gatherings of up to a maximum of 5 people still are in effect. Conformément à la recommandation de la santé publique, la Ville d'Ottawa prolonge sa suspension des événements spéciaux, festivals et autres programmes culturels autorisés par la Ville de 500 participants ou plus, qui devraient avoir lieu avant la fin du mois d'août. Les événements pour moins de 500 personnes ne nécessitent pas nécessairement un permis, mais les organisateurs doivent toujours se conformer aux exigences provinciales. La limite provinciale actuelle des rassemblements est toujours de 5 personnes au maximum. At the onset of this pandemic, the city's Emergency Operations Center quickly mobilized a gathering and events task force to continue to support event organizers. We are committed to working with the event organizers to get through this difficult time, and we look forward to the return of events in our community as they make a significant contribution to the quality of life in Ottawa. Yesterday, the province of Ontario officially entered stage 1 of its framework for reopening. As part of the first stage of reopening, the government of Ontario is permitting the use of some outdoor recreational amenities. The city is implementing access to outdoor fields, sports facilities, and multi-use fields, including baseball diamonds, soccer fields, tennis courts, and off-leash dog areas. The provincial emergency order restricts gathering of 5 or more people, and the city is working to ensure that these facilities will be made accessible in a safe and responsible manner. City crews have unlocked off-leash dog areas and will begin installing tennis nets, and the work should be completed over the next few weeks. Les équipes de la ville ont débrouillé les zones pour les chiens sans laisse et elles commencent à installer les filets de tennis. Les travaux devront être terminés d'ici au cours des prochaines semaines. Picnic tables, benches now can be used in the park. Be sure to practice proper physical distancing with people outside of your household. Playgrounds, play structures, outdoor fitness equipment, and facilities, including public swimming pools, splash pads, will remain closed until the later stages of the province's reopening plan. Sports activities that involve teams or groups remain prohibited, and we want to remind people that when taking part in any sporting activity, please do not allow groups of spectators, avoid picking up someone else's sports equipment, wash your hands regularly, and avoid touching your face. This past weekend, Bylaw and Regulatory Services responded to 305 requests for service and conducted over 870 proactive inspections of parks across the city. While no provincial notices were issued, officers issued nearly 450 warnings to individuals who were contravening the orders. On Saturday, our officers had to stop an organized soccer game being played on a soccer field at Walter Baker Park, as this clearly contravenes the provincial emergency order. And as Dr. Etchers and others have said, we can't take our foot off the gas. We must continue to social distance. I'd also like to acknowledge the work of the city's park ambassadors as they continue to educate and inform our residents in city parks. We are slowly starting to see a decrease in the number of cases of COVID-19 across the city, and we are hopeful that this trend will continue. But the evidence of the community spread continues, and so does the risk. It is imperative that residents continue to follow direction from our public health experts to help slow the spread. We need to do everything possible to protect and support healthcare workers, first responders, and other emergency personnel to help them help others in our community. Earlier this month, 24 specially trained members of the Ottawa Paramedic Service joined an initiative to test all the residents and employees for COVID-19 in 60 long-term care facilities and centers. Community paramedics conducted more than 2,000 swab tests since April 1st in collaboration with multiple partners, including the Champlain Health Region Incident Command and Ottawa Public Health. Plus tôt ce mois-ci, 24 paramédics d'Ottawa spécialement formés se sont joints à une initiative visant à faire subir des tests de dépistage de la COVID à tous les résidents et employés répartis dans 60 centres de soins de longue durée. Dans le cadre de cette initiative menée en collaboration avec le commandement des incidents de la région sanitaire de Champlain et de la santé publique d'Ottawa, les paramédics communautaires ont réalisé plus de 2000 tests plus tôt. It is just one of the many ways we are working collaboratively during this crisis. We continue to remind the public to stay home as much as possible, practice physical distancing, and do what you can to protect the health and safety of others in our community. Merci beaucoup. Thank you.
Thank you, Mr. Dumonte. I will now invite questions from each agency alphabetically. I will be going in reverse order. You may ask one question with one follow-up. Nous allons maintenant répondre aux questions de chaque organisme par ordre alphabétique. Je vais aller en sens inverse pour aujourd'hui. Vous pouvez poser une question et une question de suivi. Again, a reminder to remain on mute until I invite you to ask your question. Just so you know, Dr. Etches has to leave at 3:50 p.m. So Dr. Brent Malachny will be available to answer questions, or you can direct your questions to OPH Media Relations following the avail. S'il vous plaît, notez que Dr. Etches doit partir à 15h50. Par contre, Dr. Malachny sera disponible pour répondre à des questions, ou vous pouvez envoyer vos questions en relation média de santé publique. We will now start with your community voice. Pat Ugochioni.
My question would be for Dr. Etches. The issue around sports fields, I wonder if you can clear up for me whose decision it will be to allow organized sports to start using those facilities. I thought I heard from the province press conference that it would be up to the local medical officer of health. I wonder if you could clear that up for me.
It looks like Mr. Dumonte is going to comment on that first. He's been following the provincial orders and the enforcement.
So as it currently stands, certainly our local medical officer of health is going to be involved, but it is a provincial order, and the way the regulations are currently structured, it is the province of Ontario that will be, as they continue to evolve into their loosening of the rules that they see fit, it should be coming from the provincial government.
Okay, and Dr. Etches, with the nice weather that was out on the weekend, I'm sure everybody saw all the crowds at the Tulip Festival at Commissioners Park, and I think you don't need to look too far on my own street. Lots more cars on the streets, a lot more cars in the driveways, and a lot more people about. Do you have any concerns, like with the lifting of some of the restrictions, that people are going too far, too quickly?
I think what we're aiming for here is a balance of the risk of infection and the harms that come from not being able to work, not having income, not having social connections. And so I support the relaxing of restrictions so that we can get some balance back in terms of employment and social connections. The challenge is that what does concern me is that it doesn't take very much for this virus to take off again in terms of the number of infections in our community. And so what people have done so far is they've heard that, they've taken public health advice and done the physical distancing that was needed initially. And so now we're more mobile, we're more out and about, different sources, like you've mentioned, confirm that. But we should still be doing that with distance between ourselves. And I think this is possible. And the other thing that's very important, and I thank you for doing your part to get this message out, is that if we can't be 2 meters away from somebody else, we need to be wearing that mask, the non-medical cloth mask, to provide another layer of infection, to prevent infection, another layer of protection. And so, this is something that I've just been speaking with employers, the Ottawa Board of Trade about. Businesses are really showing their leadership here. They are protecting employees with requiring masks in the workplace. And I do ask the general public in Ottawa to do their part as well, to wear masks when you're entering into a workplace if you can't maintain the physical distancing.
Thank you very much.
Thank you very much. Moving on, we will go to Pascal-Marie Dufault, Radio-Canada.
Alors, bonjour. J'ai d'abord une question pour le docteur Etches. J'aimerais savoir, il y a une éclosion avec les sans-abri au Berger de l'Espoir. Santé publique a envoyé une équipe tester les clients, mais seulement après qu'il y ait eu une éclosion des premiers cas vendredi. Pourtant, on sait qu'ils ont une santé extrêmement fragile, on sait qu'ils sont extrêmement tassés. C'est dans un endroit qui est vraiment overcrowded, qui est vraiment surpeuplé. C'est une clientèle extrêmement vulnérable. Pourquoi avoir attendu une éclosion vendredi? Pourquoi ne pas savoir tester cette clientèle vulnérable dès le début de la pandémie?
OK, je voudrais juste vérifier que vous êtes intéressé dans une éclosion d'un logement pour les personnes sans abri. Votre question, c'est pourquoi on n'a pas fait un dépistage pour toutes les gens qui habitent dans les logements pour les personnes sans abri plus tôt?
Oui, en fait, c'est ça. Il y a une éclosion au Berger de l'Espoir, Shepherds of Good Hope. Je sais que vous faites une vaste opération de dépistage maintenant. Vous saviez déjà que c'est une clientèle extrêmement vulnérable. Pourquoi cette clientèle n'a pas été testée dès le départ, dès le début de la pandémie?
Cette population des personnes sans abri était vraiment une priorité pour notre réponse au début de la pandémie. On a créé un centre d'isolation pour les personnes qui ont des symptômes d'infection et c'était la première chose, nouveau service de la santé qui est ouvert dans la ville. Et on a un partenariat avec Inner City Health qui a un bon rôle d'aider les personnes dans le système qui est sans abri, d'identifier les personnes avec des symptômes et de faire le suivi, le dépistage. Nous avons un système mobile pour faire le dépistage pour les personnes sans abri dans les différents quartiers. Et c'était juste cette semaine, oui, on a identifié une éclosion, mais c'était au lieu d'une éclosion dans un centre, un foyer de soins de longue durée. Alors, ce n'était pas un cas qui est un début dans le centre de logement. C'était un cas où l'exposition s'était dans un autre lieu avec une éclosion. Et nous avons fait le suivi plus rapidement avec toutes les gens qui ont habité dans le même quartier que la personne identifiée. Et nous avons maintenant fait le dépistage pour tout le logement. Ça, c'est la recommandation. C'est quand on identifie un cas, on fait un processus de faire un dépistage pour toutes les résidents dans un meuble. Alors, ça, c'est la recommandation et on a fait ça.
OK. Deuxième question, j'aimerais savoir, avec les parcs qui sont ouverts maintenant, avec les gens qui sont de plus en plus dehors, est-ce que vraiment la Ville d'Ottawa a l'intention encore de distribuer des amendes ou on va relaxer de ce côté-là, on va être moins sévère?
À propos de notre intervention, si vous voulez, réglementaire au niveau de donner des amendes, notre approche depuis le début, je sais qu'on parle dans les médias beaucoup qu'on a relâché notre approche. Notre approche n'a pas changé. Seulement que de toutes les interventions qu'on a fait, seulement que 2% des gens ont eu des amendes. On continue à faire nos interventions. Écoutez, dans la majorité des cas, lorsqu'il y a eu des amendes, c'est parce que les gens ont déjà eu un avis et par la suite, on récidive. Donc, la deuxième fois, oui, on passe peut-être à l'amende. Actuellement, comme les gens ont dit, on voit que les gens tentent de respecter les distances, tentent de respecter les règles. On a mis nos ambassadeurs aussi qui peuvent aider à interpréter parce que ce processus-là change tous les jours ou toutes les semaines maintenant quand on commence à ouvrir. Donc, on peut avoir beaucoup de confusion. Notre objectif au niveau des amendes, c'est seulement d'intervenir lorsque c'est nécessaire pour une amende. L'objectif, c'est d'aider les gens à retourner à la normale, mais de respecter et qu'on ne retourne pas en augmentation des cas de COVID. Donc, c'est à cet égard-là qu'on essaie de balancer l'intervention, si vous voulez, d'amende versus que le public fait ce qu'il doit faire pour être en sorte qu'on peut continuer à ouvrir la ville.
Merci.
Merci beaucoup. Moving on, we will go to John Willing, Ottawa Sun.
Hi, everyone. Mayor Watson, now that street side retail, I guess, is open, are you more willing to entertain the idea of temporarily closing main streets to cars, perhaps to allow restaurant patios to go onto the street?
Yeah, we're actually looking at that now. I've asked staff to come back with a report within the next week to see if we can't replicate the success of some of the pop-out patios that were viewed, for instance, in Westboro the last couple of years. So staff are coming back with some recommendations. One of the reasons why I'm enthusiastic about this idea, John, is because we suspect when restaurants are given the green light to open, they'll have to practice social distancing, which means they'll have fewer places for customers to sit and eat and have a meal. So if we can help them logistically, if it works, to increase their seating capacity by allowing them to have a patio, which in the past they haven't because they haven't had the land, then I'd be in support of that. It helps the small businesses. It brings more life to the street, and I think the restaurants are going to have probably one of the more challenging times getting back up and running and reattracting their clients to come and support them during their difficult time.
Thank you, Mayor. And then just a follow-up question. This might be for Dr. Etches or Anthony. Can the city or the public health unit mandate, require people to wear masks to go into businesses, either retail shops or restaurants under law?
We do have certain powers under a state of emergency. I think Dr. Etches earlier was explaining the concept. This is to each individual. If we want to get out of this this situation where we have to restrict our activities, I think it's the responsibility of individuals. Intervention, whether it's fines or a policing style model in any way is not the way to generally proceed in a democratic society, proper policies and public policy. So it's up to each of us to be responsible and follow the recommendations of the public health team who said we should be wearing masks. Individual owners are asking people to do that. I wouldn't be in favor that we'd be using fines to do that. And I actually, directly to your question about the legal authority, we'd have to consult with our legal colleagues. There are certain powers that are given to us in the state of emergency, but I don't think that's where we want to go. We want individuals to assume that responsibility and say, this is for the benefit of all our community and we have to do our part.
John, if I can jump in as the chair quickly, we've had this discussion, and what we're looking for is we're looking for buy-in. Just as we got with the physical distancing of 2 meters, we saw, you know, the vast majority of people in Ottawa recognizing that was important to protect those around them, their neighbors, their friends, their coworkers, and it worked very, very well through education, through messaging, and just everybody realizing it was for the collective good. So we want to take the same kind of approach with masks. We want to get buy-in from the public. You want to shop at this restaurant or eat at this restaurant, they may ask you to do that. Your local hardware store may ask you to do that. It's in everybody's best interest. We've seen from the actions of our citizens in the past that they get this. They get the importance of physical distancing, and I'm confident they'll get the importance of wearing a mask when that is impossible.
Thank you.
Thank you very much. We will now go to Taylor Blewett at the Ottawa Citizen.
Hi, my first question is for Dr. Etches. I'm wondering, as hospitals start resuming some scheduled surgeries and procedures, what is that actually going to mean for our assessment center and the COVID-19 care clinics? Are you anticipating a change in the way the general public is accessing testing and primary care for COVID-19 symptoms, and I guess in the kind of the weeks to come?
Yes, I hope it will become easier and easier for the public, the general public, with any symptoms that could be COVID-19, whether it's a cough and a fever or an atypical symptom like fatigue and a headache, or to access that testing, whether it's through your primary care provider, through a mobile testing service if people have difficulty getting out. So I think we will move away from being dependent on an assessment center or care clinic model. And this is a good thing. We know we have a lot of geography to cover across our city, and we want to make sure that testing is available wherever people need it. The model was initially started to be able to take the pressure off emergency rooms that were feeling a lot of pressure to be able to manage the volume of people presenting who wanting testing and who weren't very ill. Right? We know most people that are presenting are not very ill, and we're saying that, come, even though you're not that ill, we still want to know if it's COVID. And so, people who aren't very ill don't need to come to a care clinic, something where there's a lot more infrastructure set up. We can use our regular primary care system and build on that.
And for a follow-up, when it comes to this geographic specific data that OPH is now sharing, when you look at this map and what the data is showing, I guess what sticks out to you, and what would OPH and the city, other community partners actually be looking to use this kind of data for, if anything, in kind of guiding decision making or anything along those lines?
Yeah, so I can tell you what stands out for me when I look at the maps of the COVID infections detected by lab test is that COVID is everywhere in our community. It crosses the geography. That's really the only useful thing about the maps. I'm sorry to say, but it just isn't that great data, because it's only based on the tests that have been done. It's only based on where people live. It doesn't tell us about where they were exposed. It doesn't tell us about, some of the things that could lead to different rates of infection in different communities. We know if people are older adults, they're more likely to get severe illness, so they're more likely to present for testing. So we might pick that up where there are more older adults. We know that rural areas, it tends to be easier to physically distance, so we're going to see smaller numbers in rural areas, and any fluctuation in the numbers in a rural area is going to show up as a big change also in the rate of infection. And so they're not that useful, but people want to know what information do we have about the geography, and so we're sharing it. Now into the future, as testing is more widespread, and we're trying to make sure that anybody can come forward, and we think we have more representative testing, not just healthcare workers and very sick people, that may become more useful data.
Thanks.
Thank you very much. Moving on, we will go to Sue Sharing.
Hello. I have a couple of questions for Mayor Watson, and I've struggled with how to phrase this first question. I believe, and you've lived in this city for a long time, that Ottawans are a very caring community. But I'm wondering if you can describe somehow how you, as the mayor of Ottawa, feel. I mean, obviously today, both you and Dr. Etches were very compassionate, and you're passing on your sympathies for the Peter Clark employee. Is it different being the mayor of the city with all of this going around you?
Well, Sue, this particular death hits us close to home because it's our first employee who has lost their life to COVID-19. So, it does hit home, and obviously has a very traumatic impact on the individual's colleagues at the Peter D. Clark Center in Center Point. I don't know the name of the individual. That information is not given out unless the family releases it. So I don't know if I've actually even had the opportunity or honor of meeting this employee, but I just wanted to let everyone know that this had happened. It's obviously very sad, and we're thinking of not only the family but the colleagues that are still working, providing vital care for some of our most vulnerable citizens at the long-term care home. Thank you.
What I was really trying to ask was, I mean, all this stuff is going on around us. It's funny for me knowing that I can see you and you can't see me, or can you see me?
I just see a picture of you.
It's not the one I like. No, but I mean, as mayor, do you feel more of a, I'm not trying to suggest do you feel more responsible for what's going on around you, or do you worry about that weight on you?
Well, look at, we've got a really great team of people that are supporting me, and the support Dr. Etches and Tony and Keith and so on. And the burden doesn't fall just on one person. Obviously, the people who run our long-term care homes and the staff there, are touched by this tragedy that took place, and the loss of a life. So it is, of course, it weighs on you. That we knew at some point probably one of our employees would be infected, and that day has come, and all we can do now is really offer our condolences, but also redouble our efforts to ensure that every possible measure is in place for the protection and safety of both the residents and the people who walk through the door every day to go to work to help those residents. So I know that Donna Gray has sent out a memo to members of council advising them of this sad news, and we will continue to do our very best to help those individuals who are also feeling, a sense of grief and probably shock at the loss of a personal support worker at Peter D. Clark.
Now, I don't know if this should be, my next question should be to you or Anthony DeMonte, but we've seen a lot of good things environmentally through the, people staying at home. I mean, I don't want to go on and on, better than I do, but is the city looking at measures that once this is all over that we might be able to, is there any thought given to not having everyone come into work 5 days a week? Are there any measures that you're looking at that we're going through now that could prove advantageous to the city?
Well, certainly, Sue, under our city manager's leadership, we've set up several task forces, and some of them are looking at the recovery in the future. We're also looking at experiences elsewhere in the world that are in different timelines that, had the peak way before us and are going back to normal. And those discussions have begun. What will our transit service look like? What will our future look like? Can we stagger, and can we maybe talk with the business community and the largest employer, the federal government. So yes, Sue, so some of that work has begun. We're not there yet. We're still in the early stages of reopening our community based on how the province wants to proceed. So we're keeping our eye on the ball on that to ensure that we don't backtrack. But absolutely, those are some of the questions that we're asking ourselves now. We're looking at what possibilities may be, and then maybe some recommendations, and engage the entire different groups in the community, the business sector, the federal government, and other sectors. So absolutely, those are things that we're looking at right now.
Thanks so much, both of you.
Thank you very much. Moving on, we will go to Julien Paquette, Le Droit.
Bonjour, Monsieur le maire. Bon, évidemment, la situation actuelle nous a forcé à faire plusieurs choses différemment. J'étais curieux de savoir comment votre niveau de satisfaction par rapport au fonctionnement des réunions publiques à distance et plus spécifiquement ce qu'on a vu la semaine dernière avec le comité sur le plan officiel avec une centaine de personnes qui ont été entendues. Est-ce que vous êtes heureux de la façon que ça s'est déroulé jusqu'à maintenant?
Oui, je pense que Mme Harder et M. El-Chantiri, les deux coprésidents de ce comité, fait du bon travail. C'est certainement beaucoup de monde qui offre leur opinion au sujet de le plan officiel pour la ville d'Ottawa. Je pense que c'est le deuxième plus grand groupe qui adresse un comité municipal. Le premier, c'est l'armée de salvation. Salut. Mais ça, c'est une autre façon pour encourager plus de personnes d'utiliser la technologie, de communiquer avec les comités. Et je pense que ça, c'est une chose très importante. Peut-être on avait le droit de continuer cette processus dans l'avenir parce que c'est plus cher pour une personne. Ce n'est pas nécessaire de quitter leur maison, payer pour le stationnement, arriver à l'hôtel de ville pour donner son discours pour 5 minutes. Alors, si nous sommes capables de continuer d'utiliser la technologie pour des témoins ou des personnes qui vont poser des questions, je pense que ça, c'est vraiment une bonne idée.
Parfait. Et aussi, j'aimerais vous entendre, on a M. Dimonté qui nous a annoncé il y a quelques minutes qu'on mettait fin aux mesures de surveillance pour les inondations, la crue printanière. J'imagine que vous êtes soulagé finalement de ne pas avoir deux crises à gérer en même temps ce printemps.
Oui, je pense que Tony Dimonté va répondre à cette question parce qu'il est responsable pour ça.
Merci, Monsieur le maire. Effectivement, on avait mis en place la structure pour être en mesure de répondre à deux événements, puis on a toujours la capacité. On a vécu ça avec les tornades et les inondations l'année passée, mais c'est sûr qu'avoir seulement une inquiétude qu'on n'a pas d'inondation comme qu'on a eu l'année passée à gérer, surtout dans un moment de COVID qui a rajouté d'une complexité au niveau du personnel puis le travail qui serait nécessaire sur le terrain. Donc, oui, c'est un soulagement à cet égard-là, mais c'est un soulagement d'une minute parce qu'il faut redoubler nos efforts au niveau du COVID pour être sûr qu'on peut rétablir notre communauté le plus rapidement possible.
Merci beaucoup.
Merci. We will now move on to Craig Lord at Global News.
Hi, I think I had a question for Vera, but it looks like she left.
Dr. Malakmi is there.
Yeah. So maybe this is a question for Brent. I was just curious about when we've heard a lot about in other provinces across Canada that idea of expanding the household bubble. I'm just curious if we were to see something like that, is that an OPH decision? Or is that solely the discretion of Ontario? I know they have the 5-person maximum for gatherings, but even below that, would that be an OPH decision to potentially add flexibility to that household bubble concept?
Sorry, Dr. Malakny, if you don't mind starting over.
Yeah, no, sorry about that. Got the video going, not the mic. So thanks for the question. Certainly, it's something that we've been, talking about at OPH and talking with our provincial counterparts as to when, we will be able to see some relaxation and what type of relaxation socially. I mean, a lot of the relaxation decisions to date have been to open up businesses, which is important, considering how important they are to the well-being. To specifically answer your question, it's a provincial decision in terms of any relaxation, both in terms of size of gatherings, as well as the different ideas that are being bounced around in terms of expanding your household group. And certainly I think the chief medical officer of health gets asked this almost every day in his media questions, and his answer to date has been, not feeling quite comfortable yet to include that, because, consistent with what Dr. Etches was saying earlier in this event, that the more we increase the interactions, particularly those less than 2 meters away, the more risk there is for transmission, and therefore the more risk for resurgence. And so I think that's why we have caution, but the strict answer is that it's a provincial decision.
Okay, great. Thank you so much for the clarity. My other questions have already been asked, so I'll just pass the mic. Thanks, everyone.
Thank you very much. Moving on, we will go to Josh Pringle at CTV Ottawa.
Thank you very much. My question is for Dr. Malakny. There seems to be some confusion. Premier Doug Ford has said you can interact with up to 5 people from outside your household. We've seen people in Ottawa maybe interacting with more than just their household. What is the exact guideline right now? Because there is a lot of confusion. Like, who can you interact with? Who can you have over to your house? How many people can you have? We're just trying to get some clarification.
Yeah, no, thank you for that. I don't think with respect to sort of social interactions that things have changed. I mean, the principles are the same in terms of physical distancing. If you can't maintain distancing, then the importance of a non-medical cloth mask. That under the provincial emergency order, that the maximum size is 5 people. That you're fine to socially interact with your household, and it's fortuitous that now that we have more venues to be able to do that. Previously we were just doing that, in our apartment or our home. Now we can go to the park and use the picnic bench. So that's great. But in terms of that number 5, that's still the number. And so, the number shouldn't be more than 5, unless you have a very large household.
Thank you. And my follow-up question is probably for the city. Just looking at the decision to cancel festivals and all large events for, I guess, the next 4 months now, or June, July, and August. Was there any thought of waiting any longer to make this decision, or was it a decision you wanted to make now to give everyone a heads up so they can start planning, and then also to make sure that everyone's prepared for what's happening?
Yeah, if I could just offer a comment, Tony, and then maybe I'll throw it over to you. These decisions are difficult, but unfortunately they're not, we can't give a precise answer as to when we will be able to start seeing festivals come back. So the festival network certainly told us loud and clear, at least give us a date where things won't be able to take place so that we can plan accordingly, whether it's, try to change contracts or reduce spending as a result of no performances to be put on. So, we had a conference call with a number of the festivals that were going to be affected today, and they're at least appreciative that we've now set this new date. And as you know, Toronto set the same date, I think earlier this week. So from our point of view, while it's sad news because festivals are such an important part of our joie de vivre as Ottawa residents and great for the local economy and the tourism industry, the responsible thing for us to do was to let these organizers know as much in advance as possible that we cannot allow these kinds of large festivals taking place until at least sometime in September, and then we'll have to come back, obviously, with more information based on medical advice as to whether that date will move again. Tony, do you want to add anything?
No, I think that's exactly it, Mayor. It was to assist them, and we've been in constant communications with them, and that's what they've been asking us. Thank you.
Thank you very much. Moving on, we will go to Kate Porter at CBC Ottawa.
Hi, everyone. I believe Dan Chenier was still on the call. I was wondering if now that the province has spoken about summer camps, if there's word about those 10,000 registrations that were being talked about at council last week, and whether, how summer camps might take place in the city.
Sure. Thank you. We are still planning.
Oh, sorry, Dan, we can't hear you very well.
Is that better?
That's better.
Okay. So thanks, Kate. We are planning for summer camps. We understand, both listening to the province and our own local medical officer of health, that we're going to have to modify what we do. So we're in the planning stages of doing that. The Premier was cautious in his comments yesterday that we had to see a continued positive trend in infection in the community.
Sorry, you're muscling in and out, Dan, if you don't mind.
Okay. Better?
I don't know if you're moving around, but
Nope.
just there's times. Okay, that's better.
That is better. Okay, so we are
Dan, we can't hear you.
okay.
So are you on a phone or are you using a computer?
No, I'm on a computer, but I'm right next to it. So I'm
Sometimes
not
we
sure
hear
why.
you very clearly, and other times
Okay.
not so clearly.
Better now?
This is great. So whatever you're doing now, don't move.
Okay. All right. Well, just to sum up, we are still planning for camps. We are waiting for a more definitive word from the province. And when we have those guidelines and assurance that we can go ahead, we are hoping to be able to start as early as the first week of July. But again, that will depend on positive trends in infection, as well as the province giving us the green light.
Perfect. We heard all of it.
Thanks. I think my second question is for Dr. Malakny, and that's just this Apple mobility sounded interesting as well. And, watching how people are moving about. I wonder, how many of these sorts of sources is OPH using, or could you give any other examples of how they're trying to get a good picture of, the way people are moving about, or how things are changing in the community as these restrictions are loosened?
Yeah, no, thank you for that. We are looking at a range of indicators to really try and get a sense as to whether we're continuing to move in the right direction, or to be early warning that that we may be entering into a more challenging a time towards resurgence. And some of it is like we've done some previous survey work, and that's where we reported previous information where, in terms of people distancing and that kinds of thing. We're looking at, continuing to monitor, maybe expand and get more information, say, on attitudes toward masks and using masks, because we feel that's a very important contributor going forward to control transmission as people become more active. You've mentioned, or actually Dr. Etches, and you've reiterated that the use of Apple. There are some Google Analytics as well that we're looking at that also gives information on it's just collected information from phones that Google and Apple make publicly available on what's occurring in terms of people's movements. There are other sort of analytics as we're trying to look at the data to try and get a sense as to whether transmission is increasing or decreasing, the so-called R values. So there's a variety of measures overall that we're looking at that fall into those categories that are in the provincial framework around disease transmission in particular, but others as well, to give as comprehensive a picture as we can to understand what's going on.
Thank you.
Thank you. We will now go to Laura Osman at Canadian Press. Okay, I imagine she had to leave. So we will move to Mario Aubé, 104.7. Also does not appear to be here. So we will now go to, last but not least, Jason White at 1310 News.
Thank you. So my question is, I'm looking for some clarification, and Dr. Malakny, you might be the person to clarify this. The employee of the Peter D. Clark Center who passed away, is that person's death included in the 8 deaths in today's numbers from Ottawa Public Health, or is that death not yet made its way through the system to be reported?
Thank you for the question. We'll need to check with our staff and get back to you. Certainly, there is normally
Dr. Malakny, I
a
can't
small
hear
leg.
you. I think you're on mute.
No, can you? I seem to be off mute.
Yeah, we can hear you, Doc.
Okay, thank you. So I was just saying that I don't know for sure, and we can get back to you on that. Typically, there is a delay for an unfortunate event like this before it gets into the actual reporting system and is reported. But we can get back to you to confirm that.
Okay, thank you. And I apologize. That was my fault, why I couldn't hear you. The second question, the follow-up question I had was, given the advice we've gotten today on face masks from the federal government and from the province, I'm wondering if the city is planning to make face masks mandatory for transit on OC Transpo, or if not mandatory, is there some messaging that's planned to strongly encourage people to wear face masks? Or are you just taking the approach, masks are good in public, period, across the board?
So two elements to that. We're taking the best advice of our public health group. John Manconi and his entire team at Transit have been working on this subject for some time already, actually, and they're looking at it both their provincial and their national associations. So I think you're going to see something very similar again with transit services across the country come through this. Again, we had the earlier discussion and a similar question about mandatory and enforcement, et cetera. I think it's quite clear that it is something that our medical experts are recommending. So we'll probably be moving to that. I don't know about the word mandatory. I don't think we've landed there yet, but I think that would be commonplace, certainly, that when anybody enters the public transit system, they would probably in the future be wearing a mask. Our staff will as well, too. So that's being determined as we speak. So the exact details still have to be worked out, and we're going to follow the best advice that we can get from our public health officials.
Thank you.
Thank you very much, everyone. This is all the time we have today. C'est tout le temps que nous disposons. Have a wonderful day.